Okay, so let's go ahead and get started. So for those of you who do not know me, but I'm hoping that we're becoming friends, my name is Bhakti Hansodi and I'm your facilitator today. Galaxy 7, please mute yourself, or Rise Japigo, please mute individuals who are not speaking. My name is Bhakti Hansodi. I'm an associate professor in emergency medicine. I'm the associate director for global health here at Hopkins.
John Hopkins University.
Okay, could we please Rise Japigo? Please, could you mute individuals who are not speaking? Galaxy 7 is the one that's causing the noise, I believe. And I have been oversight the COVID-19 Emergency and Critical Care Director for our engagement from the RISE project, which is a USA-funded project in India, but also 8 other countries. So we've been doing this seminar series for the last couple of months now. And you know, I think the tenets of this series have been around combating misinformation by bringing to health facilities the experts, the true leaders in these topic areas, to bust the myths, to lay forward the evidence, and to improve our own individual knowledge and our knowledge across the country to improve the care of COVID patients. And there's no topic where misinformation or confusion has led to more problems than the rollout of COVID vaccine programs. So today we're going to focus not on the evidence behind vaccines. We're not talking about effectiveness or efficacy, but we're really going to focus on a very simple topic here. What are the evidence-based strategies for COVID-19 vaccination program success? So what are the evidence-based approaches to improve vaccine confidence and to ensure that all of our colleagues, peers, loved ones, and families are adequately vaccinated to protect themselves against this variant and future variants of concern? So as we have done previously, we're going to start with a welcome address. I'm going to invite colleagues from our host organization, which today is AIMS Bhopal. Our India colleagues are going to present one case, which will focus on the India experience around vaccine uptake in patients, and a little bit more about, like, you know, some of the things that we have seen in India and what has been done to date to improve vaccine confidence. I have some questions for our panelists today, and I welcome the audience also to put questions in the chat that we'll present to our speakers. And then we're going to do an evidence-based review of the strategies, both nationally and internationally, that have been adopted to improve vaccine confidence. So who is here today, right? So here today we have 408 participants who registered, a majority of which are female. We have phenomenal representation from 26 states. And just a real shout out to Meghalaya and Maharashtra, who have the highest number of participants. You know, I recognize that there is a full spectrum of healthcare workers here, with many of you being physicians, doctors, and nurses. And the thing is, some of you may be thinking, well, I'm not responsible for rolling out the vaccine. Why is this talk relevant to me? And the thing is, being physicians and nurses and healthcare service providers, we have the opportunity to interact with individuals at a very personal level. And that is the opportunity for us to improve vaccine confidence by making sure our messaging and our approach is correct, so that we can spread the messaging around why people should take COVID vaccines to improve uptake of vaccines in the communities where we work. So without further ado, I want to start with the welcome addresses. As I said, our host institution here today is AIMS Bhopal, and it's an honor to invite Prof. Sarman Singh to welcome us to the session and to give us permission to get started. Prof. Singh? Can we confirm that Prof. Singh is on? Dr. Joshi? Okay, I don't think Prof. Singh is on. I will move forward in the need for time, and then we can always have him join us when he is available. I think Dr. Joshi, I can see you on the phone, so I presume you're trying to call Sir right now. Let me tell you a little bit about the project that is hosting this series. So this is hosted by a USAID-funded implementing partner, JPIGO, and the project under which all this work sits is the RISE project. JPIGO India is working across India through a pan-India approach, and their work is not focused just on COVID, but many activities beyond. And I just want to, many of you saw Dr. Bulbul Sood, the strategic advisor, Dr. Sumesh Kumar, the country director, and Dr. Vineet Srivastava, who's the chief of party for the USAID RISE project. So these are the leaders who are in the background making everything possible for us. None of this would be possible without funding and support from the USAID. And it's Dr. Sangeeta Patel, Dr. Amit Shah, Cynthia Gear, Vijay Paul, who have been not only advocating for the support for the COVID response in India, but also thinking about the strategy so that this project can be a force multiplier, so that we can not only prepare for COVID, but prepare for future pandemic response too. And so I just want to thank them for their generosity and their guidance, which has really shaped our engagement with health facilities in India. And this webinar is not just, this is not all we're doing. This is the very tip of the iceberg. Many of you from Hub and Spokes facilities are aware of the workshops and trainings that are happening, the work on capacitation of health facilities, oxygen ecosystem strengthening, lab and surveillance strengthening. And if you have any questions about that, please reach out to the RISE country leads, and we can answer those questions and how your facility in particular can get engaged. And then on this side, as I said, I'm from Johns Hopkins University, and Johns Hopkins University is an affiliate of JPIGO, and we've been partners in this work. And really within this activity, we are trying to bring to you the evidence to support our own individual knowledge as practitioners. And today we're going to be joined by Dr. Rupali Lamaya, who is an associate scientist at Johns Hopkins University. She's actually a bit of a celebrity. I believe she was on Good Morning America the other day. So it'd be great to hear from her some of the evidence behind improvement of vaccine uptake and confidence. So as I said, learning objectives for today's session are going to be to review the current challenges of vaccine rollout in India, and our India colleagues are going to be doing that. To discuss the current approaches to improving vaccine confidence, and reviewing the evidence-based strategies for vaccine confidence. Again, we're not talking about the effectiveness of the vaccines, the mechanism of action of the different vaccines. We're really focusing on how do we improve vaccine uptake. Dr. Joshi, I'm going to hand over to you if you're ready, sir. And then I don't know if Dr. Singh was able to join.
Yes, I am there. I am there. My speaker was not working, Bhakti. Otherwise, I am already there.
Perfect. Dr. Singh, can I hand over to you to get us started? Is that okay?
Thank you.
I'm
so
sorry.
Yes, sure. No, thank you indeed. I am sorry. So I think she has already, thank you very much, all of you. And as already I requested that I may not be full time. So I will start the discussion as Dr. Bhakti very rightly said. And maybe after that, my colleagues, 3 colleagues who are expert in community medicine, one internal medicine and one gynecology and obstetrics. So they will take over. But to begin with, as Dr. Bhakti very rightly she said, that hesitancy, probably today's main topic is that how we can improve and hesitancy against the vaccine we can take care. It is a pride for India that probably today or tomorrow we will be completing 100 crores of the vaccination. But at the same time, it is also very, very important to understand that about 70 crore people are still waiting for the second dose. So the first dose has been or will be by today evening or tomorrow morning to about 100 crore, but the second dose has been only in about 28 crore or so. So this is a huge gap in the in the fully vaccinated and single vaccine dosing. And therefore, I think the region, many a times people are thinking that what is the various regions, and already discussed. So, yeah. So the basic reasons, what people think that hesitancy, there are various reasons for that, but most importantly, people think that many of the vaccines, they are not meant for pregnant women. And some people, they think that probably if the vaccination is given, maybe they can transmit the virus to the babies without knowing that none of the vaccine is having live virus. And therefore, there is no chance of transmitting the virus to the fetus at all. Also, many female, they think that probably during lactation, they can have some side effects, and probably they can also through milk, they can transmit. So there are various kinds of myths, and, wrong information is being given. And therefore, it is very, very important that this time we discuss and we should take care that how the hesitancy is taken care. So first of all, I think the awareness is most important. Many a times, many rural women, they are not educated, and even if they are educated, they are not aware of the vaccines. And as I said, that various myths and the wrong information is being transmitted through various social media. And therefore, through this platform and other social media, this becomes the duty of all of us, those who are in the healthcare system, including the local administration, that the correct information is sent, and they receive the correct information through various platforms, that none of the vaccine is having any chance to transmit to the fetus or to the baby through milk. Another thing is that probably for last couple of months, people have also started thinking that probably corona is gone. So complacency is another reason that people are thinking that there is no need of any vaccination. And the third thing, probably I also think that people think that these vaccines, they are some of the particular group of people, they have devised some module to destroy them, something like that. Various kinds of informations and misinformations, rather, I would say, they are there. And therefore, it is again and again re-emphasized that I think so. I think Dr. Joshi, you will take over after that, Rajneesh Joshi. And I think the details, Dr. Ankur Joshi and Dr. Rajneesh Joshi can take. But definitely, this was the probably most important thing which I wanted to say, that none of the vaccine has any side effect, and we should emphasize and we should re-emphasize. So even though the 100 crore people, they have taken single dose, including many of the lactating mothers and pregnant women, but now in last 2 or 3 months, there has been huge complacency, and government and local administration, they are fighting that how to get this hesitancy. And I think with that, Dr. Rajneesh Joshi, you can take over, or maybe Dr. Ankur Joshi. So more details you can discuss. The slides are already there. I can share for you, or you must be having. So I can stop my share, and then you can take over.
Sure, sir. I think Dr. Ankur will take over from here, and then we'll move to the...
So I will stop my share, and then probably you can take.
Sure, sir. Sure.
Ankur, is that okay?
Yes, sir. Fine. Absolutely fine, sir.
Yeah.
Thank you very much, sir.
Thank you.
Thank you.
So
Thank you, Dr. Singh, for setting the stage.
So good evening, everyone. As Dr. Singh sir has rightly mentioned, the vaccine hesitancy is a complex phenomenon, and it has several dimensions. And the dimensions probably may not be addressed by a simple system process. We are traditionally accustomed to look the phenomena from the input, process, and output perspective, but probably it is something like a complex adaptive system, which is slowly emerging and slowly evolving. And I am happy to share that in spite of all this disease and all the news, India has actually launched the world's biggest vaccination campaign, and we have all the things are digitalized in our country, and lots of digital portals like COVID portals and Arogya Setu are launched by the government of India. And till yesterday, about 96 crore doses were administered as of now. So this is the thing. Actually, the disease is it was entirely a new phenomenon for us, or for that matter, for the entire world. So we are actually learning from this, and I'm happy to share that the government of India and all the other agencies work hand in hand in a collaborative approach, and not only in the time of first wave and second wave of COVID-19, but also in the vaccine productions, and the processes were accelerated, and our scientists took the Herculean efforts, and as a result, we have come with the 2 vaccines, and we had started the vaccination campaign right from the, I remember from the 16th of somewhere in the second or third week of January, and in the stepwise manner now we are able to cover the whole of the country. So with this, let's move it to a more practical scenario. So I will be requesting Revdi. Dr. Revdi is a senior resident in the community and family medicine, and she was actively involved in the COVID-19 screening duties, and fortunately, unfortunately, she has also experienced the some adverse events. So she must be the right person to initiate the case discussion. So the flow will be, we will be opening the case 1, and it will be followed by case 2. Case 1 will be dealt with by the we have the Professor of Obstetric and Gynecology with us, Dr. Jyoti Modi Madam. She will be handling the case 1. And case 2 will be addressed by Professor Rajneesh Joshi, who is the Professor and Head of the Medicine in AIIMS Bhopal. So over to Revdi. Revdi, are you ready to present the case?
Yes, sir. Am I audible, sir?
Yeah, you are perfectly audible.
Yeah. Should I share my screen, or?
You can share your screen. That will be.
I hope my slides are visible. Is it visible?
Yeah, your slides are visible.
Yeah. Thank you, sir. So good evening, everyone. So today we have come to discuss the real life scenarios of vaccine hesitancy, which we come across in a vulnerable age group, especially in pregnancy and in lactating mothers. So going on with the presentation. So the case scenario 1. So let us see a case where a 26-year-old G2P1 with no comorbidities at 10 weeks of gestation had presented to the vaccination center on around 5th of April with a concern regarding can she vaccinate for the COVID-19 disease. Having said that, she had previously acquired the infection during her pre-pregnancy period. That is, she had contracted the infection on last year, 2020 September. And after that, she has presented to us on 5th April of this year. And the next scenario is on 10th of August, that is around 4 months later, when she was around 28 weeks, she had antenatal care, and she had asked about a newspaper article she read stating about availability of vaccines for pregnant women. And her concern was the scenario different in the month of April and 5 to 6 months later? Adding to her concern, she was also anxious and apprehensive as in when the vaccine can be taken, whether prior COVID-19 is required or not. And the other last concern was...
Revati, we can stop on 1.3 and
Yes, sir.
Dr. Modi is there. Dr. Jyoti Modi. May I request Dr. Jyoti Modi to please pitch in? Okay, we are...
Okay, can you hear me now? I was requesting to be unmuted.
Okay. So, ma'am, welcome. So, we would like to know this scenario is especially selected in reference with the time. So,
okay. Revati, can you roll back? You've moved on to the next one. Can you roll back?
Yes, sir. Yes, ma'am. Just a second.
It's too long to remember,
Yeah,
but we'll take it as we go. Yeah.
Okay, so just to sum up while the lady is working, so the pregnant female, so there was basically a gray zone whether the vaccine should be administered to the pregnant women in the month of April, and sooner after that in the month somewhere I remember in the month of July, the vaccination policies for the pregnant women were incorporated by Government of India. Over to Jyoti Modi, ma'am.
Yeah, thank you, Ankur, and thank you, Revati. So I think we begin with, so this is, of course, the obstetric part is, she's at 10 weeks, so she's in the first trimester, and I am responding in April, which is 5th of April, where the tsunami was still to just about hit us of the second wave. And she has that concern about the vaccination on the background of point 1. So she asked me in April, on 5th of April, whether she can be vaccinated for the COVID-19 disease. Taking you back to first week of April, at that point, the wave 2 was just about starting. And we also know that she had earlier acquired the infection in the pre-pregnancy period, almost 6 months earlier. So she had been affected. She had been infected in the first wave. So she has been exposed. There would be some degree of immunity. In April, we still did not, in our country, we still had not opened up the vaccinations for pregnant women. And actually at that point, even UK was wondering, and about a couple of weeks later, they started offering their pregnant women with vaccination. So if I were to answer straight, point 1.1, in April, if she had a past infection during wave 1 and was fortunate enough to recover, in April, I would have had to counsel her to tell her that at this point, we were not able to offer her the vaccine, but would be glad to as soon as the regulations permit us. Ankur and others, does that take point 1?
Yeah, ma'am, definitely.
Yeah. Okay, so I'll move to point 2 in favor of time and not wait on. So while she was following it in August, she asked again, because by that time the papers had advertised, and not just the newspapers, actually it was all over. In July, our country included pregnant women also to be vaccinated, irrespective of the trimester of pregnancy. So at 28 weeks visit, and she asked me again, and at this point, now this is a person I'm fortunate enough to have who's seeking out, and he wants to be vaccinated, probably because she has been through the disease and knows the dangers. And second wave was definitely a more disastrous in terms of morbidity that we saw all around. So yes, in August, I would recommend vaccination for her. Any additional points on this, Ankur? Or
Yes, sir. As the key theme is the vaccine hesitancy, so
Yeah.
and you definitely deal with the number of obstetric women in your OPD. So, how, in general, how do you convince the pregnant women to take the COVID-19 vaccine, and what are the difficulties you face in your practice?
Okay, so a lot depends on what is the background education and level of awareness of the person. Now, this I say was lucky, but yes, try and take a more difficult person thinking about have to off. So that is where one has to start the dialogue and let them know, at least talk about the second wave. Whenever we talk about the second wave and sort of share with them the effect it has had on pregnant women and children, people do want, and women do want to protect their children. Most of their anxieties stem not for themselves, but for the baby. And so that is where we need to convince them that by August, actually, there is a lot of data on pregnant women, if not for Covishield and Covaxin, which are approved here. But even that data is now emerging. No teratogenicity has been proven. So those are the things in layperson terms we have to explain to them, depending on their level of literacy and understanding. And I would just like to bring to fore here for our Johns Hopkins colleagues that we don't meet people with a single level of literacy or awareness. We have a huge spectrum ranging from people who cannot even read or write to women who will Google and come to us. So we have to tailor our responses to them and accordingly modify how we speak to them. What really comes to our help is the public awareness drive that is going on for the vaccines on part of the government. One of the strange apprehensions which I did come across and is repeated is people have a feeling that when they get the vaccine, their immunity actually falls for the first couple of weeks. So that has to be allayed. Does that answer some of the things?
Yeah, definitely, ma'am. We will come back to you after some time. Revik, now can we move to case 2, scenario 2?
Yes, sir.
Please.
Dr. Joshi, in the interest of time, do you think I could move to the panel discussion instead? Or do you want to finish case 2 first?
Probably we can address case 2, then we can move to panel discussion, ma'am.
Okay, great. Thank you.
Okay, so Revik, case 2.
Yes.
Okay, Revik, you may continue, please.
Yes, sir. So going on to case 2, a 32-year-old who's a G2P1 at 18 weeks of gestation. Here we have a case of a medical complication. That is, she is a known case of rheumatoid arthritis, and she's currently on a steroid of methylprednisolone and also on sulfasalazine. She presented to her routine ANC care at a tertiary care hospital. And we will hear from the internal medicine expert what could he have done if he had received a reference call with a similar case scenario. So let's go to the first concern, 2.1, whether COVID-19 vaccine could be given in such a case. And
so, Revti, in interest of time, if it's okay, I'll respond to these queries.
Please, sir.
Yeah. So my emphatic response to anyone who comes with any medical illness is risks of COVID-19 far outweigh the risks of vaccine. So everyone should get vaccinated. One, whether it is rheumatoid arthritis, diabetes mellitus, hypertension, pregnant women, because we are focusing on universal immunization. As many people get immunized, it is better. Now, issues are that, okay, concurrent administration of vaccination or 2 different vaccines, should I say I have to receive a tetanus booster. So usual responses, if you are getting a vaccine administered on the same day, get it done on 2 different arms. If it's possible to keep a gap, we usually advise a 4-week gap, but we don't know when next wave will hit us. So I'll always prioritize COVID-19 vaccine at this point of time, especially when we have already passed the second wave. There are a number of people who will ask about adverse effects. There are vulnerable groups, immunocompromised individuals, individuals who are taking number of drugs, steroids, immunosuppressants, or maybe various other drugs along with it. Now, again, real evidence in many of these scenarios in terms of differential effect of the co-administration of medications is still hazy. In general, if somebody is taking immunosuppressants, we may have an apprehension that vaccine efficacy may be less. But as of now in India, we are not talking about a booster dose. Our first target is to get 2 doses of vaccine, what is available. There may be a concern about somebody's taking aspirin or any other medication. Again, focus is that co-administration of other medication doesn't interfere with COVID-19. Please continue your previous drugs as you were and get a vaccination dose. There may be some risk in terms of fever or maybe some arthralgias, myalgias, which are usual reactions to vaccination, which would usually pass off in a short period of time. The proportion of real life threatening events has been very, very small. And we need to always weigh it against, what havoc we have seen, especially during the second wave when there was a high mortality. So comorbidities or no comorbidities, my basic task is to reassure and emphasize that vaccination will always do you more good than avoiding it in garb of any comorbidities there. So that will be my quick and response. I think, Bhakti, we can move to the panel discussion or the next speaker's discussion.
Thank you, sir.